1996, I returned back to school to work on my doctorate in maternal and child health. During that same time frame, my sister, who was expecting, she delivered a set of twins, and 4 days later, she expired from preeclampsia.
As a Black woman, I do know that we have a 4 to 6 time increased rate of perishing from maternity and carrying our babies more than our Caucasian counterparts.
So I do worry, about at delivery, am I going to be taken care of? Will I survive? Will I live to see my babies?
And to think that my sister had suffered the very fate that I was working toward eliminating. It is still my goal, it's still my deep passion. Although I have some hurts and bruises, I always look toward the big picture of helping our Black mothers deliver healthy babies.
As soon as I found out I was pregnant, my #1 priority was finding a provider that was ultimately going to listen.
I want to make sure that doctors and nurses are actually listening to what their patients are telling them and what they're telling you as the human who is actually experiencing the birth.
When I got the epidural, my nurse asked me, had it kicked in, and I told her no. She touched my thigh and she was like, "Can you feel that?" And I said, "Yes, I can feel that." And she said, "No, you can't." I could feel everything. I felt her, the whole experience. Listen to your patients, listen to them. Everybody's situation is different. Just because it doesn't normally go that way for one person or one situation, don't mean it's impossible. I want to be heard. I also want my wishes to be respected. I want people to take my healthcare seriously.
As a healthcare professional, as I've experienced medical bias, I've seen medical bias, everyone has to have someone to advocate for them. If you feel like you're not being heard, you're not being understood, find another doctor.
A lot of times in the birthing space, some of the things that have been passed down through history, like we don't feel pain, or sometimes it's like they feel like we're being dramatic. Eventually we're going to get to a place where we are treated equally, where we are heard, where we are considered, where we are seen as human.
The future of Black healthcare looks like more so freedom. Freedom in your thinking, freedom in like your remedies, freedom in your overall relationship with your providers.
The future of Black health looks like for us, by us.